The medical oncologist we consider as the quarterback of the cancer care team. We're responsible for making decisions about chemotherapy regimens. We also interact with the radiation oncologists and the surgeons to come up with a complete plan for our patients. Patients are our friends and neighbors. We know that we run into them in the supermarket. We know that for a lot of them we've been friends with them even before they become our patients, and we sometimes become friends with them after they're our patients. And we strive really to make sure that not only are their medical needs met, but that we also meet their emotional needs and those of their family members. What we strive for in the Cancer Center is an atmosphere that is not tense, one where patients can interact with other patients, share their own experiences. What we found is that even more important than a social worker or a trained healthcare professional discussing what's going on with them emotionally, the patients interacting with each other really provides much more comfort. Nobody knows better what somebody's going through than another person who's going through the same thing. As a small community hospital, we're often asked by our patients, how can we be sure that we get the same quality care here that we receive at a big cancer center? We have access to many clinical trials that allow our patients to receive state-of-the-art treatments right here in their own backyard. What that means for the patients is that they no longer have to travel long distances for their care. And more importantly, as we often see with patients undergoing chemotherapy for cancer, there are a lot of side effects, and the patients require, in addition to the chemotherapy, supportive care, which is much better given in the convenience of the local hospital. The treatment of cancer is not just about administering drugs, not just about radiation therapy or surgery, but it's about the relationships they have with the providers. And we have an excellent team here, from our physicians to our nursing staff to our dietitians and our social work. Everyone strives to make sure that all of the needs of the patients are met, and that when our patients come through the door, they are not just a number to us, not just another patient, but really one of our neighbors, and that we know that we'll be treating them today. Tomorrow they may very well be our friends. I think back on some patients. There's a patient of mine, he's probably a year or two older than me, who I really didn't know prior to his illness. Since then we've become very good friends, and he was very ill during his treatment course. And there was a time when I wasn't sure he was going to make it through the treatment. Not only has he recovered, he's cured of his disease. It's more than 10 years since his diagnosis. And for me, the best part is I've had the opportunity to see him interact with his children as they've grown up, see him at really important moments in his children's lives that he might not have been there for. Knowing that because of the treatment that he received at our center, he was able to be there for his children when they really needed him, really is probably what is the best reward we have for doing what we do.